Welcome, everyone, to vpod.ai. I'm Mike, and my guest today is Susan. You can sponsor this podcast for just $25. Your message will be featured across major platforms like Apple Podcasts, Amazon Music, Spotify, and more. If you're interested, visit vpod.ai to get started today. So, I want you to imagine taking a pill that's meant to save your life, right? But then you find out it's secretly, draining the electrical grid of your own body.
Oh, absolutely. It's like turning a minor bout of dehydration into, a catastrophic system failure.
Exactly. And if you are tuning in today, you probably want to understand the actual mechanics of human biology. You don't just want to accept a prescription and hope for the best.
Right, because we are manipulating the fundamental physics of the human cardiovascular system here.
Right.
Which is, not something to take lightly.
Yeah. And to be clear, our mission today isn't to induce panic. I mean, these interventions are a medical triumph. They prevent heart attacks and strokes for like tens of millions of people.
Right.
But when you alter pressure and flow in an ecosystem that delicate, there are structural trade-offs.
There really are. Serious complications are uncommon, sure, but we are forcibly rewriting the body's operating system.
Right. So we want to equip you to recognize when your internal plumbing actually needs medical attention.
That premise is just so crucial. We often treat blood pressure as just a number on a chart, right? But it is literally the physical force driving oxygen into every single cell.
Which means lowering it artificially forces the kidneys and the heart to operate under new chemically imposed rules.
Exactly. The side effects aren't just random symptoms. They are logical consequences of the drugs doing exactly what they were built to do.
So let's look at the foundational example of that. The silent chemical shifts triggered by diuretics, or, what people commonly call water pills.
Yeah, water pills sounds so harmless, doesn't it?
It really does. But if we view the cardiovascular system as like a closed-loop hydraulic network, a diuretic is essentially opening a release valve.
Yeah.
The pressure against the vessel walls is dangerously high, so the medication commands the kidneys to flush fluid out.
Right. Less volume in the pipes means less pressure. But as that fluid rushes out into your urine, it drags critical, highly charged minerals along with it.
And that's the catch, isn't it?
Yeah. Diuretics don't just magically pull water out of the blood. They actively block the kidneys from reabsorbing sodium. And water naturally follows sodium.
So by forcing the sodium out, the water just has no choice but to follow.
Exactly. But the structural cost is that this forceful eviction takes other essential electrolytes with it. You get a significant depletion of magnesium, which is hypomagnesemia.
Wow.
You also get dangerous drops in sodium called hyponatremia. And perhaps most critically, you lose potassium, which we call hypokalemia.
And we hear about electrolytes in sports drinks all the time, but this is way more serious than just a post-workout recovery thing, right?
Oh, definitely. These minerals maintain the electrical potential across every cell membrane in your body. They dictate whether a nerve can fire or a muscle fiber can contract.
So if you're taking these meds, specifically loop diuretics like Lasix or Boomex, what does that drain actually feel like?
Well, the initial signs are incredibly subtle, which makes them dangerous. You might just think you had a long week at work. But a gradual drop creates a profound, heavy weakness.
Just feeling totally drained.
Right. And your muscles might misfire, giving you sudden, painful cramps, especially in your legs.
I know the thiazide class is huge too. Things like hydrochlorothiazide or chlorthalidone.
Yeah, those are first-line defenses for millions of people. And as sodium levels drop with those, your brain actually struggles to transmit neural signals efficiently. You might get cognitive confusion or like a persistent brain fog.
It's so counterintuitive. You treat your heart, but your brain gets foggy because the sodium gradient is flattened.
Exactly. Which is precisely why a healthcare provider must be drawing your blood regularly. You cannot feel your cellular gradients shifting until the system crashes.
So what happens if we look at the exact opposite? Like, if diuretics flush out potassium, what happens if the body hoards it instead?
That is hyperkalemia. And it's caused by entirely different classes of medications. Things like ACE inhibitors, the Pril drugs like Zestrol or Altef.
Or the ARBs, right, like Cozar and Benicar.
Yes, exactly. Also Tecturna and a specific diuretic called aldactone. They interrupt the hormonal signaling, so your kidneys aggressively hold on to potassium.
Wait, if low potassium causes weakness, I'm guessing a massive surplus is, pretty bad for the heart.
It creates complete electrical chaos. The heart relies on a very precise influx and outflux of potassium to maintain its rhythm.
So it just can't reset between beats.
Right. It's a stealthy buildup. You might feel a vague fatigue at first, but as it escalates, it triggers severe heart palpitations, sharp chest pain, shortness of breath, and vomiting.
It literally transforms a silent imbalance into a sudden cardiac emergency.
Which reinforces the main point here. Whether your medication flushes minerals out or pulls them in your blood, relying on physical symptoms is a failing strategy. The routine blood test is completely non-negotiable.
Okay, let's shift our perspective from those invisible blood panels to side effects that are alarmingly visible, because there's a staggering paradox in the data about ACE inhibitors and a condition called angioedema.
Yeah, the statistics on that are frequently misunderstood. Angioedema is this sudden, severe swelling of the deep tissues beneath the skin.
Right. And the data shows it occurs in less than 1% of patients taking ACE inhibitors, a fraction of a percent.
Exactly.
But then if you look at emergency room admissions, ACE inhibitors account for a massive 1/3 of all angioedema cases. How are that math even possible?
It's just a matter of sheer scale. ACE inhibitors are a foundational pillar of modern medicine, prescribed to tens of millions of people globally. So when you multiply a microscopic percentage of risk by 50 million daily users, you generate a massive volume of people experiencing this severe reaction.
So it remains incredibly rare for the individual, but it's a daily reality for emergency room doctors.
Exactly. And the biology behind it is fascinating because it isn't a standard allergy.
Right, ACE stands for angiotensin-converting enzyme, and we use a drug to block that enzyme to keep the blood vessels relaxed.
Yes, but that same enzyme has a secondary job. It breaks down a protein called bradykinin.
And bradykinin makes blood vessels widen, right?
Right. It's a powerful vasodilator. It widens them and makes them highly permeable. So because the ACE inhibitor stops the enzyme from breaking it down, bradykinin rapidly accumulates in the tissues.
Wow.
The blood vessels become so permeable that fluid massively leaks out into the surrounding tissues.
It's essentially localized internal flooding.
Yeah.
Visually, for the person experiencing this, what does it look like?
It presents as profound, rapid swelling. Your lips might balloon outward. The tissues around your eyes can swell so drastically that your eyes are literally forced shut.
That sounds terrifying.
It is. Your hands and feet might become painfully tight and puffy, often with intense itching or hives. But the real life-threatening danger is when that fluid leaks into the tissues of the throat and larynx.
The airway physically closes as the tissues engorge with fluid.
Within minutes. And while angioedema has that direct link to ACE inhibitors, we have to remember that traditional allergic reactions are a risk with any blood pressure medication.
Right, which means if you are listening and you start a new prescription, or even if you've been on one for years, you have to treat facial swelling or hives as an immediate crisis.
Oh, absolutely.
You do not monitor it. You don't just leave a message for your doctor. It is an escalating biological emergency. You need immediate, aggressive medical intervention, like calling 911.
The speed of that tissue engorgement cannot be understated. You have a very narrow window before intubation becomes impossible. You have to act immediately.
Okay, that covers the immune and biochemical rejections. Let's pivot to the unintended mechanical consequences, because high blood pressure is notoriously difficult to manage.
It really is. The data shows over 70% of patients require polypharmacy, meaning 2 or more different medications, to bring their pressure down.
Right. You are attacking it from multiple biological angles. You might have a diuretic reducing fluid volume paired with an ARB forcing the vessels to stay dilated.
You're intentionally overriding the body's natural systems to force the numbers down. But the therapeutic window is narrow.
So when those medications work perfectly in tandem, you run the risk of overcorrection. The pressure drops too far, resulting in hypotension.
Exactly. Low blood pressure. The systemic pressure falls below the threshold needed to pump oxygenated blood up into the brain.
And that causes an immediate wave of dizziness, headaches, and severe cognitive fog.
Yes, but the most dangerous manifestation of this overcorrection is orthostatic hypotension.
This is a failure of the baroreceptor reflex, isn't it? Like when you're lying flat, your heart doesn't need much force to supply the brain.
Right, because there's no vertical gradient. But the moment you stand up, gravity violently pulls the blood volume down into your legs.
Normally, sensors in your neck detect that sudden drop and instantly trigger your blood vessels to constrict, pushing the blood back up.
Exactly. But we just flooded the patient's system with medications specifically designed to paralyze that exact constriction reflex.
So the blood vessels are chemically blocked from tightening up.
The compensatory mechanism is entirely disabled. The blood pools in your legs, your brain is briefly starved of oxygen, and you experience a severe syncopal episode. You black out.
For you listening, this mechanical failure is a devastating real-world risk. If you wake up at 2 in the morning to use the restroom and stand up quickly, you could fall.
And a fall resulting in a fractured hip or a traumatic brain injury is often a permanent, life-altering event.
So you must consciously change how you navigate gravity. You cannot leap out of bed. You have to sit for a moment, let your system adjust, and then stand slowly.
You are literally manually managing your blood flow because you chemically disabled the system that used to do it for you.
Okay, I want to explore one final mechanism that highlights a terrifying biological synergy. ACE inhibitors and ARBs are legendary for protecting kidney function, right?
They are. Doctors prescribe them specifically to shield the microscopic filters in the kidneys from the pounding force of high blood pressure.
Yet simultaneously, these exact same protective drugs are listed as a primary cause of acute kidney injury, like a sudden loss of renal function. How is that possible?
It is the ultimate pharmacological paradox. The medication itself does not change. What changes is the physiological environment around it.
The perfect storm.
Right. To understand it, we have to look at the physical plumbing of the glomerulus, which is the filtration unit inside the kidney.
Let's build that model. You have an inflow pipe bringing blood in and an outflow pipe taking blood away.
Precisely. Under normal conditions, your body constricts that outflow pipe to create a bottleneck. This builds up back pressure inside the filter, which forces waste out into the urine.
But if you have high blood pressure, that bottleneck makes the pressure dangerously high, physically shredding the delicate tissues.
Exactly. So ACE inhibitors and ARBs force that outflow pipe wide open. The bottleneck is removed, the pressure drops to a safe level, and the kidney is protected.
Okay, the pressure is relieved. But acute kidney injury happens when we accidentally drop that filtration pressure to absolute zero, right?
Yes. And that requires compounding factors. We have the ACE inhibitor holding the outflow pipe wide open. But what happens if the patient gets a severe stomach bug or becomes intensely dehydrated?
The raw fluid volume in their entire vascular system plummets. Less volume means less baseline pressure arriving at the kidney to begin with.
Exactly. So we have low volume arriving, and the exit valve is chemically pinned open. The pressure in the filter is already critically low.
And here's where the everyday choices become fatal. Let's say the patient has a headache. They go to their medicine cabinet and take a common over-the-counter NSAID like ibuprofen.
That is the trigger. NSAIDs have a very specific effect. They severely constrict the inflow pipe. They pinch off the blood supply entering the filter.
Oh, wow. The synergy is catastrophic.
It really is. Systemic dehydration means there's barely any fluid volume. The NSAID chokes off whatever blood is left. And the ACE inhibitor ensures that whatever tiny amount does make it, it flows straight out the fully dilated exit pipe.
So the physical pressure inside the glomerulus drops to zero.
Completely to zero. Without hydrostatic pressure, filtration completely stops. Waste products build up in the bloodstream immediately.
And the kidney tissue itself becomes starved of oxygenated blood.
Within hours, you transition into acute kidney injury, and the organ just begins to shut down.
It is a profound realization that a simple drugstore pain reliever, when combined with dehydration and a standard prescription, can orchestrate a total organ failure.
It underscores the immense responsibility of managing an altered internal ecosystem. You cannot casually mix over-the-counter chemicals into a system that is already heavily manipulated.
The context of your entire organism matters.
A protective mechanism in a hydrated, stable patient becomes the mechanism of destruction in a dehydrated one.
Let's synthesize this into actionable parameters for you, the listener. Number 1, respect the invisible chemical shifts. The loss of sodium, magnesium, and potassium happens silently.
Right. Routine blood monitoring is the only way to catch those shifts before you have a cardiac event.
Number 2, respect the physics of orthostatic hypotension. If you take vasodilators, you must give your system time to fight gravity when standing. Transition slowly.
Avoid those syncopal falls at all costs.
Number 3, angioedema and systemic swelling are immediate emergencies. Facial swelling or airway trouble requires 911, not observation.
Immediately.
And finally, guard your internal ecosystem. If you are on ACE inhibitors or ARBs, Do not mix them with NSAIDs like ibuprofen, particularly if you're dehydrated.
The plumbing just cannot sustain that overlapping interference.
So Susan, as we wrap up, what's a final provocative thought we can leave everyone with?
Well, think about this. We've explored how a few milligrams of an engineered chemical can completely rewrite your reflexes, manipulate your hormones, and override your kidneys.
Wow.
Okay? If these targeted medications can so profoundly reorganize the physical forces keeping us alive, consider the thousands of minute variables we introduce daily.
Like our basic habits.
Exactly. Every ounce of water you drink or fail to drink alters your plasma volume. Every trace mineral in your food subtly adjusts those cellular electrical gradients.
Wow. So we are constantly, unknowingly acting as the architects of our own internal pressure systems.
Yes, the medications are blunt instruments, but our daily habits are making silent, microscopic adjustments to this incredibly delicate ecosystem every single second.
It totally reframes the concept of human biology from a static machine to a constantly shifting hydraulic network. We are actively modulating that environment with every choice we make. Well, thank you for thoroughly deconstructing the physiological mechanisms at play today.
It was a pleasure. Thanks for having me.
And to you listening, thank you for engaging with the complex reality of how your body actually functions. Keep questioning the mechanics of the medical interventions around you. And above all, stay curious and well-informed. See you next time.